Cameron here, registered physiotherapist. Today I'd like to talk about one of the intervention modality strategies that I like to use sometimes with patients. But before I begin, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So what I want to talk about today is one of the modalities that I find very useful, right? In conjunction with, again, empowering patients with an exercise program, identifying the specific muscles that need to be isolated in order to get stronger, in order to look at any sort of movement dysfunction. So again, I'm very much with this idea of empowering patients with exercises, but there does come a place where modalities can be helpful, particularly if a muscle has a specific tone, if there's pain in certain ways that need to be addressed, right, before the patient can do more of the exercise-based therapy. Well, I use acupuncture every once in a while in terms of treating patients, and one type of acupuncture technique that I find really helpful is a technique called balancing. And essentially what this means is needling different body parts, right, in order to treat a certain area so that the patient can actually do movements, and or we could do perhaps some other type of hands-on treatment while we're also, right, treating the area with acupuncture. And so the way that this works, I just wanted to give sort of a brief explanation, is that with acupuncture, there's things called meridians, and meridians are you can almost think of it like a line that goes through different areas of the body, right? And so what we can do in terms of a treatment method that they talk about in this balancing technique is you can use distal points in these meridians to treat a different area that might be in a higher point of the meridian. The other area that you can, so for example with that, you might be able to put some different needles in, let's say the wrist hand area, right, in order to treat maybe on that same side an area in the neck. So for example, I could be placing some needles in through the hand area, have the patient perhaps go through some gentle neck movements, or perhaps myself, I could be working with the patient, have the needles in, and do some hands-on treatment. Another interesting area that I find with this sort of balancing technique is you could be treating the opposite side with needles, right, in order to treat a body part on that other side. So for example, with the balancing technique, there could be points in, let's say, the left elbow that I can use to, again, put the acupuncture needles in, which might then impact and influence the right knee. So again, I could be having the patient do certain maybe mobility exercises on the right knee while they're also being treated with for that right knee with points in the left elbow. So again, I find it's a great technique, modality to use with a patient to maintain and empower them, right, to do movements, to be more active while they're also getting treated with the acupuncture to perhaps help with tone, perhaps help with circulation, perhaps help with some sensitivity within the area while maintaining a sense of empowerment and being active, which is a big sort of core piece for me in terms of making sure that we're able to empower the patient, right, to be able to treat themselves and be as independent as possible in the treatment approach. Thanks again for watching, and have a great day. Take care.